Well, we saw a surge in coronavirus cases after Thanksgiving, and experts predict the weeks after Christmas and New Year's could be even worse. The holidays are already straining Georgia's COVID testing resources. Deborah Tuff has more on that.
Dr. Jeremy Willis owns Priority Laboratories in Union City. They process about 50 tests a day. He says that's up from just a few daily in October, but take a look at these numbers. On a larger scale, numbers from the Georgia Department of Health show that we're averaging nearly 40,000 tests a day this week alone. Tuesday was the second highest testing day on record. And since Thanksgiving, the average daily testing is up a whopping 24%. Even more, the number of confirmed cases each day shot up by 111%. And with Christmas, health experts believe positive case numbers will only get worse.
We want to do the same things that we were doing before the pandemic in the midst and the height of the pandemic. And as contagious as this virus is, you cannot do that.
It shows that, number one, the cases are spiking in this virus, that people are being proactive and taking charge and being able to know their status as they go about their day-to-day activities.
Dr. Willis predicts by this time next month, the nationwide death toll from COVID will increase from 3,000 deaths a day to about 5,000 deaths a day.
The Georgia Department of Health says in a week there's already been a 9% increase in positive COVID cases, the highest numbers yet in our state so far. What used to be records is now the norm here. Georgia's 7-day average for new cases is now above 5,000 each day. We added another 5,200 today. And hospitalizations are still on the rise as well. The state reporting more than 3,700 people currently receiving inpatient treatment for COVID. 300 additional patients were added today. You can count on 11 Alive to bring you the latest on COVID-19 in Georgia. It is a one-stop shop. You can check the special coronavirus section of our 11 Alive app for daily breakdowns of case numbers, updates on the vaccine, and much more.